You have two adrenal glands, also called suprarenal glands, because they're superior to the renal, the kidney. So there's an adrenal, there's an adrenal. These are located with the kidneys in the retroperitoneal space, which means they're behind the abdominal peritoneum, the lining of the abdomen. During embryonic development, the adrenal glands differentiate into two different areas, structurally and functionally. They're different. So there's a large peripheral area called the adrenal cortex that you can see here, and then the adrenal medulla is in the middle. So there, in addition to this, there's a connective tissue capsule that covers the entire gland, and the adrenal glands are very highly vascularized. Histologically, when you look at the adrenal glands, the cortex is divided into three regions: the outermost zona glomerulosa, the middle zona fasciculata, and the innermost zona reticularis. And then deep to the zona reticularis is the adrenal medulla. So let's begin by talking a little bit about the three different zones that make up the adrenal cortex. The outer zone, which is just deep to that connective tissue capsule, is the zona glomerulosa. Glomerul means little ball, so glomerulosa, little balls, the zone of little balls. So its cells are closely packed and arranged sort of in spherical or ball-looking clusters, and they secrete hormones called mineralocorticoids because they affect mineral homeostasis. The middle zone, the zona fasciculata, a fascicle is a little bundle, is the widest of all three of these zones, and it consists of cells arranged in sort of long, straight columns. The cells of the zona fasciculata secrete mainly glucocorticoids, primarily cortisol, and they're named because they affect glucose homeostasis. The inner zone of the cortex, the zona reticularis, reticule means network, so the cells of the reticularis are arranged in branching cords, and they synthesize a small amount of weak androgens, or what we typically think of as male hormones, because these are steroid hormones that have a masculinizing effect. Aldosterone is the major mineralocorticoid that we'll examine. So it regulates the homeostasis of sodium and potassium, and by doing so helps to adjust blood pressure and blood volume. Aldosterone also can help with the excretion of hydrogen ions in the urine, and by removing these hydrogen ions, remember hydrogen ions make something an acid, it can help to prevent acidosis in the body. So acidosis, of course, is any time that the blood pH drops below 7.35. So the aldosterone is a part of a pathway that begins with the secretion of renin, the activation of angiotensin, and then the secretion of aldosterone. I'm going to warn you now. Take some time and look over this next little diagram that we're going to look at. It's not that difficult to understand if you follow it through step by step. So here we go. You ready? All right. So let's talk about the RAA, or Renin-Angiotensin-Aldosterone Pathway. So the stimulus that starts this pathway could be dehydration. Remember, that's loss of water. A deficiency of sodium. If you lose sodium, you're going to lose water. Or hemorrhage, bleeding. You've lost water, right? So all of that leads to a decrease in blood volume, which means there's a decrease in blood pressure. So far, so good, right? This lowered blood pressure is going to cause cells in the kidneys to secrete renin. Okay? Once there's renin in the blood, angiotensin that's in the plasma is going to be converted to angiotensin 1. So the liver makes angiotensin, or angiotensinogen. Gen means beginning, and it's usually inactive. So angiotensinogen is going to be converted to angiotensin because of the increased renin. Okay? All right. So now we've got angiotensin 1 floating around in the blood. As the blood flows through the capillaries, especially those in the lungs, the enzyme, angiotensin converting enzyme, ACE, converts angiotensin 1 to angiotensin 2. Now blood levels of angiotensin 2 rise. Okay? Angiotensin 2 stimulates the adrenal cortex to release aldosterone. Aldosterone travels through the blood to the kidneys. When aldosterone gets to the kidneys, it causes sodium-potassium pumps to be built. Remember when we talked about aldosterone being a steroid hormone and how it diffused across the membrane and bound with the receptor, and it turned on the gene and we made sodium-potassium pumps? That's what we're doing here. So in the kidneys now, we're building sodium-potassium pumps. They're going to be inserted into the walls of the little filtering units in the kidneys, and we start pumping sodium out of that filtrate. So that means we're keeping sodium in the body, because if it stays in the kidney filters, it's going to end up in the toilet. So if we pump it out, we get to keep it in the body. So sodium, because of osmosis, is going to enter the blood. Okay? As it enters the blood, water's going to follow. All right, that water is going to, or I'm sorry, I said sodium's going to move because of osmosis. Because of osmosis, the water's going to follow that sodium, right? We know about osmosis. Water moves from where there's more to where there's less. Water always follows that sodium. So what happens? All of that gets resorbed into the blood, and that increases blood volume. When we increase blood volume, blood pressure increases. Now that angiotensin we talked about way back over here also causes vasoconstriction of arteries. You learned about this when you learned about the heart, right? When we talked about blood pressure. So that angiotensin causes us to retain sodium and water, but also vasoconstriction. And all of this together does what? It helps to return blood volume and blood pressure back to normal levels. Now, I warned you there would be several steps, but it's really not that complicated if you follow every step through and see what's happening. The Zona Fasciculata secretes glucocorticoids, that primarily cortisol, that regulates metabolism and resistance to stress by increasing blood sugar levels. So how do glucocorticoids work? Well, they increase the rate of protein breakdown, especially in muscle fibers, and when they do so, they release a lot of free amino acids into the bloodstream that can be used for protein synthesis or making ATP. It causes liver cells to convert amino acids or lactic acid to glucose so that neurons and other cells can use it for making ATP. This conversion of something other than glycogen or other sugars into glucose is called gluconeogenesis. Neo means new, right? Gluco, sugar, genesis, make new sugars. It also stimulates lipolysis, or the breakdown of triglycerides, and releasing fatty acids from adipose tissue into the blood. Glucocorticoids can work to provide resistance to stress. That's why we call it the stress hormone. So the additional glucose that the liver cells end up putting in have a high source for making ATP to combat a wide range of stresses, such as exercise or fasting when you're not eating, if you're afraid, or extreme temperatures or altitude changes, bleedings, infections, surgery, trauma, disease. Yeah, right, a lot of stuff there. Okay, so resistance to stress by providing those extra routes for making ATP. Glucocorticoids can inhibit white blood cells that usually will participate in the inflammatory response, but unfortunately they can also slow tissue repair, so slowing wound healing. But high doses can cause severe mental disturbances. So glucocorticoids, though, can be useful in treatment of chronic inflammatory disorders like rheumatoid arthritis. Also, high doses of glucocorticoids can depress the immune response, and this is one reason that they're given very often to transplant recipients, because it does slow that tissue rejection by depressing the immune system. The zona reticularis secretes weak androgens. The primary one is dihydroepiandrosterone. Yeah, now you know why we call it DHEA. After puberty in males, the androgen testosterone is released in a much higher quantity by the testes. So the androgens secreted by the adrenal glands in males is usually so low that the effects are insignificant. Again, the testes are producing high levels of testosterone. In females, though, the adrenal androgens play an important role. They promote libido, or the sex drive, and are converted into estrogens, feminizing sex steroid hormones in other body tissues. After menopause, though, when the ovaries stop making estrogen, all female estrogens then come from the conversion of these androgens to estrogens. Adrenal androgens also stimulate the growth of axillary hair and pubic hair in boys and girls right before they have that pre-pubertal growth spurt. We don't really know exactly what controls the release of the androgens from the zona reticularis, but the main hormone that stimulates its secretion is adrenocorticotropic hormone, as we saw earlier. The middle part of the adrenal gland is the adrenal medulla, and it's a modified sympathetic nervous system tissue. So it develops from the same embryonic tissue as all the rest of the sympathetic nervous system, but its cells don't have axons, so they form clusters around large blood vessels. So rather than releasing a neurotransmitter, as nervous cells do, they release hormones into the bloodstream. So the hormone-producing cells are called chromaffin cells, and they're innervated by sympathetic nervous system neurons. So because the autonomic nervous system exerts control over the chromaffin cells, they release those hormones very quickly into the bloodstream. The two major hormones made and secreted by the adrenal medulla are epi and norepi, also called adrenaline or norepinephrine. So the chromaffin cells of the adrenal secrete unequal amounts of these cells. About 80% is epinephrine and about 20% is norepinephrine. And the role of these hormones secreted from the adrenal medulla is to intensify the autonomic sympathetic nervous system responses in other parts of the body. So by allowing these hormones to travel through the blood out to target cells in the body, you're going to have that increased response of increasing the heart rate and force of contraction and dilating the airways and increasing blood glucose, rather than just that short burst that you would get from the sympathetic neurons releasing epi and norepi as neurotransmitters. And here we have our little summary table. Our mineralocorticoids, primarily aldosterone from the zona glomerulosa, increase, can be stimulated to be released because of increased potassium. So if you just walk yourself through all of these as we saw earlier, this is going to help you understand what controls secretion and what the primary actions and where each one of these are from. Again, we've already talked about them, so I'm not going to read a table to you. And there you have the DHEA from the zona reticularis and the epi and norepi from the adrenal medulla. I do want to talk to you just a little bit about some disorders associated with the adrenal gland. The first one I want to talk about is Cushing syndrome, where you have hypersecretion of cortisol by the adrenal cortex. Causes include tumors of the adrenal gland, and specifically the tissue that secretes the cortisol. Or you could have a tumor that is causing excess secretion of adrenocorticotropic hormone from the anterior pituitary, and that's going to stimulate excess secretion of cortisol. But the condition is characterized by breaking down muscle proteins and the redistribution of body fat. This usually results in very spindly, skinny little arms and legs, accompanied by what's called a moon face and a buffalo hump, so a very rounded face and an abnormal deposition of fat on the upper part of the back. Sometimes there's a very large and hanging abdomen as well. The base of the skin can appear flushed. The skin of the abdomen sometimes develops stretch marks. A person bruises easily and wounds don't heal very well. Elevated levels of cortisol can cause high blood sugar or hyperglycemia, osteoporosis and high blood pressure, increased susceptibility to infections, reduced resistance to stress, and mood swings. Addison's disease, hyposecretion of glucocorticoids and aldosterone, sometimes called chronic adrenocortical insufficiency. Most of these cases are autoimmune, where antibodies cause the adrenal cortex destruction or block binding of adrenocorticotropic hormone to its receptors, and of course that's going to decrease the release of the cortisol and the aldosterone. But also there are pathogens like the bacteria that causes tuberculosis that can trigger the breakdown of the adrenal cortex. Symptoms usually don't appear until about 90% of the cortex has been destroyed, but they can include mental lethargy, anorexia, weight loss, hypoglycemia, muscle weakness, nausea, vomiting. Low aldosterone can cause you to have increased potassium levels and low blood sodium levels. That's going to mean you're going to be excreting excess sodium in the urine, which means you're going to excrete excess water. That's going to lead to low blood pressure and dehydration. Decrease your cardiac output, which can lead to arrhythmias or even cardiac arrest. A lot of times one of the characteristics of this is the skin has a bronzed appearance that people may just think you have a suntan. And this was seen in President John F. Kennedy, but his Addison's disease was only known about by a few people when he was still alive, but it became much more widely known after his death. So treatment for this consists of replacing the glucocorticoids and the mineralocorticoids with drugs or with supplements, and also increasing the sodium in the diet. And then the last one I want to mention to you on these adrenal disorders is Pheochromocytomas. So these are usually benign tumors of the chromaffin cells in the adrenal medulla, and they cause hypersecretion of epi and norepi. So it's basically a prolonged version of the fight or flight response. Elevated heart rate, high blood pressure, high glucose, and increased urine output, increased basal metabolic rate, and nervousness and sweating, and decreased gastrointestinal activity. Wow, imagine being on a constant adrenaline rush. Sounds like it might be fun for a few minutes, but I don't think I would want to deal with it for a long period of time. Surgical removal of the tumor is usually the effective treatment for this. And here you can see the adrenal gland has been bisected, and you've got two halves of the tumor here within the adrenal medulla.